Okay, good afternoon, good evening, wherever you're joining us from. My name is John McGrath. We're resuming our LinkedIn Live sessions that we have previously run. We've certainly run in-person events all around the world with these people. The purpose today is to look at a very challenging issue for pharma in terms of, as we come out of, we look at how quickly the COVID vaccine was developed. That's certainly putting pressure across the industry. And sometimes when we talk about pharma, we've the big five of pharma. Well, I'm pleased to say today I've got the big four of pharma in terms of the panelists that are joining us. So without further ado, I'll ask each of you to introduce yourselves very quickly, beginning with yourself, Hardeep, if that's okay.
Sure. Hi, everyone. Good morning, good afternoon. My name is Hardeep Kaur, and I am joining from Merck & Company, primarily in change management, communication, and operational excellence. Nice to meet you all.
Okay, great. And Magnus?
Yeah, sure. Hi, Magnus Ytterstad, and I am working with Captario, which is a software tool working with portfolio management across pharma. In my previous life, I was working as a portfolio director for one of the big pharma companies there.
Okay, great. Joe, if you want to jump in.
Yeah, thanks, John, for having me. And my name is Joe Stalder. I'm a VP of Program Management at Zentalis. I'm located in San Diego. I've been in the industry for about 20 years and in program management for about 15 of those. My take on this session is mostly from the small biopharma perspective. So I've been at large and small, but I'm going to talk about this topic from a small company perspective.
Okay, great. And Sachin?
Yeah, hi, everyone. This is Sachin Raje. I head the Strategy Realization Office for Global Medical and Scientific Affairs at Merck & Company based in New Jersey. Happy to be here.
Okay, great, guys. So thanks very much. So a huge amount of experience. So I'll kick off by asking you, what are the key challenges pharmaceutical companies are facing in terms of the strategy execution in your own organizations or across the wider sector today? Anyone like to take that question?
If I can take a first crack at it, just to open the door here. One of the biggest things, this goes across big and small companies, but especially for small companies, matching the strategy to our resources. Do we have enough money? Do we have enough people to execute on all the big ambitions that might come across? There are so many things that we can do with our molecules, with our assets, with all the indications, with all the unmet medical need. But do we have the cash to execute? And do we have the people in a small company to be able to prosecute the ideas that we have? So that's one of the biggest challenges, aligning the ambition to the resources that we have.
Yeah.
Okay.
I think that's a good point. I can take that to the perspective of a large company then. I think one of the key challenges is the enormous amount of risk involved in drug development and a lot of the uncertainties that we have if we're in the clinical setting and taking a product all the way to launch is a very uncertain project. And when we set the strategy, oftentimes what I see is that we don't really look into the uncertainty. We create a couple of different options to take the project forward. And then we decide on one of those. And those options are very often project plans. And project plans tell us more about what we want to happen rather than what is actually likely to happen in the project. And so we set the strategy based on a dream in many ways. And so once it comes to executing on that, we find ourselves looking into delays, and we kind of play catch up with the project the whole time.
Okay, that's interesting. So listening to all of you, I get the sense in the organizations you're in that there is always more opportunities than there is revenue investment or resources to back it up. So this comes to that sort of, I think, Achilles heel of both pharma and other industries. How do you decide what to prioritize in terms of your execution? So there are, 10 new blockbuster drugs you could develop. You're going to pick one. How do you prioritize that as such, or for other aspects of your business as well?
Yeah, John, I'll take a stab at
So, John, if
that.
I may take a step.
Go ahead, Sachin.
All right. So
Sachin.
I don't come at this from a drug development standpoint, because that's not what my function is. But if you take any strategic initiative and you take the execution of that, I'm just going to put a broader level from that perspective. One of the biggest challenge that I see in having large strategic initiatives which are to be managed, and especially which need cross-functional and cross teams management, is the prioritization of this in the first place, because the clear understanding of so many of different kinds of priorities which are over there, even in terms of the things that each individual has to do himself, and the priorities which are there for the company, which there may be quite a few of them. Sort of picking and choosing what the prioritization should be is often the key challenge. So of course, that's where you have whichever sponsor has the loudest voice basically tends to get a little more of the resources. So I'll just stop there.
Okay. Hardeep, do you want to jump in?
Yeah.
Oh, sorry,
Yeah.
Margaret.
Please go ahead.
Sachin, I just wanted to add to what you were saying, right? So I think the bigger problem I see is really the discipline to say no, right? So I think oftentimes when I'm thinking about strategic, corporate enterprise-wide strategy, it gives you an edict. It's almost like a compass and a GPS of guidance. But what we don't do a very good job of, like, where do you say no, right? And I think we feel like that mentality of like everything done and everything can be prioritized. So I feel like somewhere, perhaps there is that component of really how disciplined are we of saying no to things that don't line up with our corporate and enterprise strategy. That's kind of.
I think it is a mix of so from a portfolio perspective, I think it is a mix of actually having some good data-driven metrics that we create. That is one component of it, or one perspective that goes into this prioritization process. Another one, and I read about this abbreviation, which is HIPPO, highest paid person's opinion. I think that actually has a lot of influence into it. There is bias in setting the strategy, and I also think there are a lot of different strategic targets, and prioritizing the target actually also dictates what projects you're going to choose in the end. If you have a priority to make it into a new therapeutic area, let's say, then you're going to pick those projects if that strategic initiative or if that strategic target becomes the most important thing.
Yeah.
John, I have a point on that too, and this is tagging off Magnus and Sachin saying, sometimes it depends on the people in the room. In order to remove that bias, to remove the politics out of the discussion, you need data, like Magnus is saying. You need data that has specific criteria that everyone has agreed to before you go into this exercise of prioritization. So once you have the criteria set, you enter the data into a system like Captario, and you have an output that you can use as your evidence base on making these prioritization decisions. No one should be able to argue with that because they agree to the criteria, they agree to the data, match the data to the criteria, and then you should have a good idea of where your priority should be. And it takes the loudest voice in the room out of the equation. In theory, that's how it happens. In reality, there's always going to be personal, there interplays, there's politics, there's just a lot of complexity of decision making that comes into it. But that's where we as project managers can add the most value, is having good, accurate, up-to-date information and applying that to a standard set of criteria that the organization has agreed to.
That's very interesting, Joe. I'm going to dig deeper into that. So we've heard about sort of big data, AI for the last 10 years. I often used to think it was about smart data, not big data. The reality is about 90% of data that organizations capture, they get no ROI on it. So both to yourself and to the wider platform, are you harnessing data? And there's obviously room for improvement, but do you think you're doing an okay job in that? Or how important is data? Hardeep, I'm sure, like myself, is from the people side of it, and we'll certainly come to that in a moment. But from the data, I think that's a very interesting point you made, Joe. Would anyone care to take that up? Are you guys harnessing data?
Because I ended it, let me start with this one.
Okay.
The challenge that I have at a small company is our data set to train an AI machine is not large enough to make it useful. So, we might have 10 trials going on. We might have 3 indications. We might have 1 or 2 molecules. That data set is too small to train an AI on how to guide us on future indications, future areas of investment opportunity. So that's, we need a larger data set. If there was a way to link up our data set with a broader pool across the industry and then be able to get insights out of that, that might be a way to do it. Or if you're at a bigger company, I saw a presentation recently at, I think it was Sanofi's R&D Day, how they're using AI and a tool called Ally to guide their decision-making. And they have a big data set. They can do that. They have hundreds of molecules. They have thousands of trials going on. They can do that within their company. Smaller companies don't have that large of data set.
Okay.
I think to add to that, one of the problems, even if you have a lot of data, it often sits in different parts of the organization. So you have the PMO owns the timelines for projects. You have finance, they own the costs, and you have the commercial strategy or a commercial function that owns the commercial data. And what I find working with a lot of different companies is that it can be actually difficult to get hold of that data because some of these groups are very protective about their information. They don't want it to be taken outside of context or outside of their control. And so that becomes a problem. And that is, I guess, resolved with communication. So when I work with an individual team, I say, you need to give me your data, but I'm not going to take it anywhere outside. You're going to be the ones that get whatever analytic and reporting that we can do. We're not taking it anywhere else. And I think that goes for the bigger picture as well, when you get data from many different sources in the organization.
So you need less hippos and more data. Is that the case, Matt?
Less hippo, more data. Yeah, I think so.
Hardeep, over to you.
Yeah, so Magnus, like your point actually, got me thinking, right? So, data is just data. It's not going to, you present it in masses. It's not going to necessarily do anything for you till you take that data and decipher it and tell a story about it, right? It's like, what decision are you actually trying to influence? And I think moreover, and, when it comes to the people side of it, you have to take probably that data set and again, tie to your strategy in terms of decision making, right? Will you have a better decision making with that particular data set, or what are you actually trying to drive for the business? So for me, it is great to have data. Clearly, I think as AI takes shape, we're definitely going to have robust visualization, robust BI reports, but it really goes back to what are we trying to drive from a corporate strategy perspective.
That's an excellent point, I think. So yes, so if you bring all the data together, you can create a forecast, let's say, and that's gonna feed into your strategic decision. You need to know what the decision is. That's one aspect of it. And then I can annotate the slides and say, all right, in this line chart, the blue line is higher than the red one. So let's pick the blue project. But there is someone in the company that has more information about exactly what is that first project, the blue project, and what is the red project. And so there is a context bit that has to come into play there as well. And so you need to kind of work with all of these groups and get their perspectives into the mix as well.
Okay, so just to people watching us live on LinkedIn, apologies, your comments haven't popped up, so there's some technical errors. I'm just seeing them now, so I'm just going to take some of these if that's okay. So the first one here is there's a point about regulations as a challenge, so that the nature of the industry and regulation, while you're trying to execute quicker and harness data, that you are essentially tied to the old way of doing things. Any thoughts of commenting along that without annoying the regulator or making a career changing for all the wrong reasons today? Comment. Anyone would like to take that, the regulatory environment you work in?
I mean, I can speak from my experience, right? So the regulations are there as guidelines, right, to provide us, sort of guide rails in terms of what you can operate and what you can actually execute. So I always feel like you have to keep that in the backdrop for any execution, whether it's a huge strategic initiative or whether it's just a simple compliance, requirement changes. So we cannot be dismissive of those requirements. And we just have to make sure they're well integrated into what we are actually trying to achieve. So it has to be a win-win, right? But those are always going to be front and center.
Okay, great.
I can take another perspective on that question is use of real world data and real world evidence. There's a lot of discussion about it in our industry because it is a good way of gathering a large amount of data. However, the FDA still prefers, and obviously they prefer randomized controlled trials for approvals. That's the best data generation and evidence base for an approval. So the problem is for the industry, how do we use this real world data, which is supposedly cheaper to gather and quicker to gather? How do we use this real world data in combination with randomized controlled trials to support indications and support the progression through the regulatory landscape? I don't think there's an answer yet. I don't think anyone has an answer. That's kind of where we are with the use of large amounts of data in the regulatory landscape.
Okay, so I'm going to move to a different aspect now, guys. So we all know that it's always about execution. Strategic planning, most organizations are good at, but they tend to fall down on execution. I remember seeing a report by a large consulting house where they said up to 80% of strategic plans never get realized. So I suppose in terms of, there's 100 years of industry experience in the virtual room here, at least, any tips you would give to your pharma peers in terms of how to execute better?
John, I can maybe get started, right? Go ahead, Sachin. I keep interrupting you. Go ahead.
No,
you
no,
go
no.
first.
It's yours this time. You first, please.
So one of the concepts that I'm kind of really starting to get a handle on is called the transformation deficit, right? So it's a new concept that sort of I came across, and the idea there is, with all the changes that are going on in the world, whether it's past the pandemic, whether it's the data that's coming with all the digitalization that's happening, whether it's working, hybrid working, there are lots and lots of changes. So one of the aspects that we might want to think about is really the deficit around keeping multiple aspects to drive your transformational changes, right? So it is really just about not only quality delivering, there's also this component of people are going through a lot of changes. There is this change fatigue element to it. So if we were to really keep the strategy execution, it's not only all the old paradigms that we've learned around, cross-functional collaboration, but it's also keeping in mind that how folks are actually going to navigate through those changes and the processes. So I just want to make sure that there's a balance there.
Okay.
Yeah, that's an excellent point, Hardeep. I just wanted to add on to that, again, on generalized, large strategic initiatives. One of the things which I've seen, and this has happened since the last 20 years that I've been doing management consulting, is the fact that the stakeholders are not clearly understood, and that's one of the starting points you identified, right? For the stakeholders are not properly identified. Let's start from the beginning. When you think about any normal kind of a strategic initiative, you have these 2 or 3 or 4 obvious stakeholders that we say, and you say that's what you're designing this thing for, whatever that thing might be for. And it turns out that if you haven't taken the time to think of the other stakeholders who are there, who could be of help in executing in some case, because they either have the ability to impact or get impacted, and we haven't identified those very well, you'll find that the execution starts unraveling very, very quickly. So one of the reasons why initiatives do get on track fairly quick enough is the notion of change management that Hardik talked about, and change management is not in the context of just training and communication, right? So it's basically knowing what are the impacts that are going to be there and how you can leverage those people, how can you can get them involved because they have either influence or they are impacted, and how you would basically get them to support or manage the pain that they are expected to go through. So that to me is one of the significant things which happens in executing a strategic initiative.
Okay, so you've touched a nerve there slightly with me, Sachin, in terms of, and I think of something, a discussion I had with both Hardeep and yourself over the last number of years, and that's the idea of the transition from a PMO, a project management office, to an SRO, strategy realization office. So this is a question for the wider panel. Are you seeing that in industry? Is it happening out there? Where is the transition in terms of, is the PMO getting that seat at the executive table where it operates as the wise counsel for execution of strategy? Anyone?
So the
concept on an SRO?
Yeah, the short answer, if I may start off, is no. I don't quite see PMOs quite getting as quickly into the SRO position as we probably thought maybe a few years ago, right? And that's probably, and first of all, what is the essential difference between the PMO and the SRO is that seat at the table, right? So there could be other ways of thinking about it, but to me, that is the significant thing, and that is not very quickly coming on and happening. The projects or the portfolios are which are set up for execution in terms of the program management also are set up still on the hippos and what we call the CEO hunches, right? So like it is where, hey, I think this should be a program and we should kick off and do it, and this sounds like a good idea, is something which is there. The translation of the strategy, which is of course clearly in the C-suite, and translating that into programs which need to be executed and why, is the domain of the SRO. And that's something which is not really something which you're getting the seat at the table yet.
Yeah.
Anyone else?
I think so. I think that is exactly right. And I think why do we want the PMO to get into the SRO? I think one good reason to do that is to put the risk back to where it belongs, which is the strategy realization office, or with the stakeholders that have actually made the decision that we're going to go ahead with these initiatives. And as we started off by saying that there's a lot of uncertainty in drug development, what usually happens is that the project team comes up with the plan. The plan is an idealized way. This is what we want to happen, and the investment committee or stakeholders, they say, yeah, let's go ahead with that. And what's happening then is that you're pushing all of the risks onto the project or onto all of these different projects. And so when delays happen or things go wrong, you have decentralized all of the risk, and the people that can actually do something about it, the stakeholders, they don't feel that it's their risk, it's on the different projects. So if you can bring all of that back into where the stakeholders are, there are a lot of different ways to kind of do that. Then you're creating a better position to actually do something about problems, or you have a better framework for realizing your strategies, I would say.
And I think Magnus, to bring up a good point, right? So, in terms of risk sharing, right? And there was a comment made by, one of the listeners. It's about the ownership of risks, right? So who actually owns the decision making, and who is going to actually own up the risks? So I think when you come to sort of the dichotomy of who's making the decision, I think the PMO or the SRO or the strategy office wants to own that. But when it comes to the risk dissipation, it becomes everybody else's problem. So, the accountability component is the biggest fight that has been going on forever in terms of the SRO or PMO. So that once we sort of solve that, maybe it becomes, clear in terms of the integration between the two, because I agree with Sachin, right? All of these strategies are set behind the scenes, and the execution needs to happen. And if you don't involve the people who are going to be executing while you're setting up the strategy, there is always going to be flaws in there.
I think I have a point about that kind of captures all these together, is the space that the PMO or SRO can really own is owning and managing a scorecard. So your organization creates these strategic goals, and the PMO or SRO can develop a scorecard that captures those goals and helps the organization track to the progress against those goals throughout the year and throughout multiple years. And so I think having a scorecard and even having a dashboard, and this is something Magnus can talk about with his experience at Captario, having dashboards that track the metrics towards achieving those goals. And that could be at a level of a clinical trial, enrollment metrics. It can be at a level of number of indications that we're moving from pre-IND to IND into the clinic. It could be the number of NDAs submitted for a year, depends on the scale of the company. But having scorecards like that really help identify the risks to the goals and then be able to take action on them.
Okay. Anybody, just something as I listen to you, and it's something wider. When we talked about strategy 5 years ago, the term innovation came up. Nobody talks about innovation anymore in pharma, certainly in terms of, has it been replaced by the change management concept, or it's just something as we listen, we talk about strategy. The word innovation hasn't been mentioned. And just while I'm listening to you here, I think about, in a previous life, I spent 8 years with Pfizer, and we had innovation for breakfast every morning. Now it's never mentioned. Why is that, do you think?
I don't think innovation has gone away. Maybe it has changed structure. I mean, I read a lot about new ways of conducting trials after the pandemic. Decentralized trials started to become a much bigger thing, and that's innovation. That's trying to avoid some of the risks of running clinical trials and recruiting patients and so on. So I think there is some innovation still happening.
Okay.
Actually, I am kind of surprised that you mentioned that innovation is not coming up as a term very often these days, because I just came from facilitating a 2-day innovation workshop.
Okay.
Now with the Gen AI, and stuff, and bubbling up and mushrooming and coming out of the fore everywhere, the I word, the innovation word, has actually come out into even greater focus suddenly, right? Hasn't it? Because there are lots of opportunities for innovation coming up from just that one thing which happened. We are on the next huge wave, apparently, and I think companies are scrambling to see what are the kind of things they can start doing innovatively. And the first thing that comes up is, let's do something with Gen AI. But even otherwise, I think it's kind of created that little spark for the explosion around innovation, which I think is crucial.
So I need to change my strategy, friends. Is that what you're telling me, Sam? I'm not hanging around with the right strategy people if they're not talking about innovation. Hardeep, it's all over, I'm afraid.
No, so John, I was reading an article a couple of days ago, and I think most of the businesses are actually going through the transformation stages. In fact, I think the increase in transformation projects, whether it's programs, are actually up by 38% from last year to this year, and all because of the AI. So I think all of that is actually tied to the innovation. So I don't think so. Maybe it's actually taking a different name, which is business transformation or digitizing it. But underneath all of this is still innovation. You have to look at new ways of working and new ways of doing things, which then just brings me to one last point I want to mention around the change management component, right? So, as we think about our leadership skills and as we think about what has worked in the past may not necessarily work for us in the future. So, at business transformation, whether it's strategy perspective, whether it's a PMO, whether it's a SRO, think of some of the people capabilities and skills that you are going to need to transform your businesses and do your strategy execution successfully.
Okay. I'm just looking at the time, guys. We said we try and wrap it in 30 minutes, which we haven't done, so that's okay. But before we do finish, what I would like you to do is to make a future focus prediction, if you could, in terms of strategy execution in pharma. Would anyone like to give us a prediction?
I think one thing is going to become more clear as we start to understand AI and machine learning a little bit more. We're going to need to clean our data, and this comes into the sense of our project management data, our execution data. We have data all over our enterprises, and it's all in different formats and different headings and everything. All the metrics and cycle times, everything is different. That needs to be systematic before a true AI or machine learning implication can be made. So I think we're starting to realize we've been able to do this in the past, as Hardeep says, but it's not going to be the way of the future. We need to have a better way of getting a handle of our data before we can start using some of these great tools.
Okay, I like that observation from Claudia, who is based in New Jersey. We've met previously at PMI events. So that's an interesting way looking at innovation. I just thought it was very interesting to pop that up there. So we're innovating around the tools we use as opposed to maybe coming up with the ideas. We're leveraging technology for innovation. I think is a very valid point. Okay, so that kind of ties in with what you're saying as well, I think, Joe. Okay. People will know that none of the questions are prepared in advance. There's nothing scripted here. You can hear the silence and the shock as I ask these questions to their panel. They're going, oh my God, what am I going to say? So I think it's always better to be authentic than polished in a panel discussion. So this is as real as it gets. Who's next to bare their soul?
So if I this has always been an interesting one to answer, because you're crystal ball gazing, and sometimes you can say things and nobody really cares, and sometimes it comes back and haunts you because 3 years later somebody looks at the recording and says, that's what you said. I mean, is that what you thought that's going to happen? Well, but interestingly enough, what happens in what I'm seeing happening is, because of the fact that we are on this very, very interesting cusp of a new wave of technology happening, I think there are such immense ways of imagining what we could possibly do with differently from the way we have been doing things in the last 15 and 20 and 30 years, right? We really haven't had significant changes coming, especially if you focus on project management as a thing to do, other than maybe some tools coming in to help over the last 25-30 years, and then some minor changes becoming more from deliverable based into more maybe benefits based and more outcomes based and stuff of that kind, right? But here we are at a cusp where we can use technology, and technology can create opportunities for us to, and free us up really to start thinking about how to manage these things better, rather than to spend time on the drudgery and the guesswork which was there earlier, because now we can really have the harnessing of the data done by machines a lot better. So
okay, Magnus or
Well, I think that as Joe was already saying, data and being able to analyze that data using AI will certainly become a big thing, not just for successfully executing on your strategy, but for everything. I think like translational science, that's where it's happening now, and you have a lot of information, and you're now starting to train AIs and machine learning programs on that data. And I think so I think, I don't know exactly how, but I think that the success rates for drug development will come up a little bit from this. We'll be better at picking the more successful projects earlier as something that I think, with the help of AI and
so
being able to analyze
Monte Carlo simulation 5.0, is it, Magnus?
That's what I'm talking about. Exactly. Yeah, no. So AI will have that impact, and I think it'll make us make better decisions in terms of prioritization and everything, strategy.
Okay, great. And Hardeep?
I think I'll just add to everything that everyone has said. To me, it's really just removal of non-value add tasks and making better use of my time, right? So I can do more valuable tasks, which is really managing the stakeholders, really communicating the change initiatives and managing the transformation in a different way.
Okay. So the just a wrap up takeaway I might sort of, as I digest what you guys are saying, is the importance of data. The principle being, in God we trust, but everyone else bring data. And then the second one of that, I think, is to recognize that organizations do make good decisions, but they make better strategic decisions if there's data involved to support almost the quantitative should support the qualitative, that you can't do one without the other. And I think the larger your organization is, that becomes more of an issue as well. Okay, I'd like to thank the panel. It's always very good to volunteer for these events. If you have a topic you'd like us to discuss, we may look at doing something again next month. We haven't done any of these for a while. It's always good to get back into it. Apologies if I looked a bit panicked at the beginning, because the live on the platform we streamed said 0 listeners. So I was scrambling in the background to see, so we were live. So I didn't dare tell the panel because they were in full flight. But technically the gods were smiling today. So we thank them for that. To all our listeners, thank you very much. And we will see you again. And I'm going to end the broadcast now. Thanks very much, everyone.
Thank you. That is great.
Thanks, everyone.